Right, now this is all rather complicated looking, but it's not really. This is sometimes described as, after the author, Alan, so I can actually use this pointer, Alan Williams. It's often called Alan Williams' plumbing diagram because it looks a bit like a central heating system. If you can imagine, these are the radiators and these are the pipes connecting the radiators. So you can imagine a sort of central heating system. And so it gets referred to as this plumbing diagram. And it's an attempt to summarize all the different sorts of areas that make up the subject area of health economics. Alan Williams is a very interesting person. It's a very interesting health economist. He's one of really the founding fathers of health economics, and indeed one of the relatively few health economists who's ever died. Now that's not because health economics gives you longevity. You know, health economics is good for survival. I don't think that's the case. It's a new subject area, and being a new subject area, a relatively new subject area, most of the people studying it, well, at one point were quite young, and so it's he had a full and very happy life, I should say, so there's not a cause for sadness, but he is one of the few health economists who's no longer with us. Right, let's work through this. Now, there's various points here that to highlight. First of all, if you ever studied economics at all, sort of Economics 101 or something like that, you probably were introduced to the concept of demand and concept of supply. And so what factors affect the demand for a good, what factors affect the supply of the good, and then their interaction together in the market. And the market generates signals which consumers respond to, signals which producers respond to. And so, indeed, in this context, we can imagine a demand for healthcare, a supply of healthcare, and the interaction would take place in some form of market. Now, we see a bit of that, but in most countries in the world, in fact, I would say in every country, the government is unwilling to leave all the decisions about healthcare, all the decisions what healthcare to provide, who's to get it, and that sort of thing, what technologies to use. The government's unwilling to leave it to the marketplace. Now in lecture 5, we'll go into some detail as to reasons why governments, and I mean all governments, I can't think of a single one that doesn't, to some extent, want to regulate the market. We sometimes think of the United States as being, United States of America as being a country where private healthcare is dominant and the market determines what happens. Well, even in the United States, I think it's 48% of the spending on healthcare is federal government money. So even in the sort of bastion of free enterprise that the United States is, even there, the government's playing a major role in the health economy. It's a question, yes?
It's not a question.
Or comment.
Is there any way that you can share that PowerPoint slides with us?
Ah, yes, I can. I can. We were just discussing this about 10 minutes ago. I wasn't too sure whether at this university you put things on a sort of site and students download, or whether you get hard copies distributed, and the suggestion was it was rather more common to get hard copies distributed. And so at lunchtime I will pass my memory stick over, and I'm not guaranteeing they'll all be immediately copied, but certainly we'll have, well, yes, I'm sure it'll happen quite quickly. So yes, sorry, thank you very much for pointing that out, yes, yes. Because of course, nice while it is to be filmed and recorded, I guess it'll be a little while before all that's available and by then you'll have forgotten all about health economics. So yes, so it will happen. I just can't make a commitment as to how rapidly the printing will happen, but I'm sure it'll be quite quick. Okay, right, so the point there was, yes, as in traditional economics, in health economics, we do have demand for healthcare, we have supply, we have a market sometimes, but frequently the government replaces the market or introduces regulations on the market's behaviour. And one important area in health economics is to consider what determines demand. Now, obviously, many things affect our health, and healthcare is only one of them. Now, in a school of public health, we hardly need to emphasise that. Maybe in other areas of medicine, that's sometimes overlooked, the contribution that other factors make to the determination of health. And so that's one area of study in health economics. So for example, individuals engage in some behaviours which are very good for their health. It won't have transformed my health, but we walked up the stairs. We didn't take the elevator to come to this class. Well, if you do that routinely, you are, through that behaviour, one hopes, having a beneficial effect on your health. There's also things we do, or some of us do, that are rather bad for our health. Some of us drink too much alcohol. When I say some of us, I mean other people, not me. But some of us smoke and things like that. There's lots of things we do that are actually bad as well. Well, those behaviours are susceptible to study with economic methods. Now, an interesting area of health economics is to ask the question, well, what is health and what is its value? Now, if we were some other part of the economy, suppose we were studying the computer industry, you wouldn't spend a lot of time thinking, so what's the value of this computer? I mean, you just wouldn't. But health is actually one of these areas where we do spend a lot of time thinking, well, first of all, what is it? And what is its value? And the reason for that is, if you are going to at all intervene in markets and in healthcare markets, you do have to start addressing these issues about what is the value of better health. Now, in the computer industry, it doesn't matter, because we're quite happy to leave it to all the individual consumers to make their individual decisions about whether they want to buy a HP. Sorry. This lecture is brought to you by HP. That's not a Japanese make. I'm surprised. Oh well. Now, in that sort of industry, the government doesn't worry about, oh, we're going to provide this type of computer only, not this one. But in healthcare, that does become an issue. And so the whole question of what is the value of health is an important topic. And because governments are frequently replacing the market in terms of demand and supply of healthcare, you have an area of health economics looking at the evaluation of different health technologies. It might be new drugs, it might be imaging technologies, it could be anything to do with healthcare. And because we're not leaving it to the market to make these judgments, but we're trying to, maybe some sort of committee is going to make, or ministry or whatever, is going to make a determination whether something should be provided or not, you then have to have an alternative mechanism for calculating the benefits, calculating the costs. And that's the sort of topic we'll be examining particularly in Lecture 6. Now, another whole area of health economics concerns the healthcare system as a whole. And again, it is a system. It's to some extent organised. And so there are issues of planning, budgeting, monitoring, what mechanisms to use. And that's another area that health economics tries to comment on. So those are the main areas. And as I say, we're going to start, well, this afternoon and Monday. I guess we're in this territory here. The idea is social capital may be a contributor to health behaviours, and therefore maybe the demand for health care, but it may also influence how people value health care. So that's the sort of territory we'll be in there. And as I say, on Wednesday, we're going to be more in this territory here. If you're replacing the market and how are you going to make decisions, and what sort of information, how can you combine the information to make judgments about specifically perhaps the cost effectiveness of different ways of providing healthcare. So in this short course, we're not going to try and cover everything. Those are the things we're going to cover.